At the AfriChild Centre, we work to improve children's well-being by grounding solutions in local knowledge and lived experience. In 2025, our African-led research elevated community voices, strengthened local leadership, and generated evidence that helped shape policies and action for children across Africa. The Centre is committed to creating a world where every child thrives, guided by three pillars. 1. Research generation. 2. Increased use of research in policy and practice. And 3. Improved organizational capacity. At AfriChild, we go beyond generating knowledge. We produce evidence, drive action, and build partnerships that place children at the center of development. In 2025, AfriChild conducted 14 studies across 8 humanitarian settings in Uganda and Ethiopia. The center managed 31 active studies during the year, launched 13 new studies, and completed 18. We shared findings from these research initiatives across multiple platforms and engaged diverse communities to inform policy and practice. Throughout the year, we work closely with communities, government institutions, and civil society partners to address persistent challenges affecting children, including access to quality education, child protection, mental health, and participation in decisions that affect their lives. Research remained central to our work. We conducted rigorous, high-quality studies that amplified the voices and lived experiences of children and produced practical evidence to inform policy and programming. One innovative study recruited 318 young adults who participated in the 2015 Violence Against Children survey as children, using non-invasive biomarker methods to examine how exposure to normative violence becomes embedded in the body over time. In education, AfriChild promoted child-centered and inclusive learning approaches through school-based initiatives, community-led early childhood development interventions, and creative programming. The Ubume project showcased the potential of integrating arts in education, improving enrollment, retention, learning, and the overall mental health, especially for displaced children. Child protection was another key focus. AfriChild worked with local actors to strengthen systems that prevent violence, neglect, and exploitation. Community dialogues, training sessions, and advocacy efforts raised awareness and improved reporting and response mechanisms. We invested in people to strengthen evidence-informed policy and practice. Through the PURE program, 32 policymakers and practitioners, including district officials and representatives from child-serving organizations, completed a training in research use, study design, data collection, and ethical analysis. AfriChild also built research capacity through the Inter-University Research Methods Training and Mentorship Program, reaching 44 participants from 10 universities across Uganda and Ethiopia. This was supported by 9 mentors and 7 trainers. Partnerships were also central to our impact, linking research, policy, and practice. The center worked closely with government ministries, development partners, and academic institutions, as well as grassroots organizations. Additionally, we also established new strategic partnerships across Africa. These collaborations expanded reach, improved coordination, and supported sustainable, child-focused solutions. AfriChild strengthened its regional and continental influence as an observer with the African Union. The center participated in both the 45th and 46th sessions of the African Committee of Experts on the Rights and Welfare of the Child, held in Maseru, Lesotho. In partnership with the Griffith University, the Inter-Parliamentary Union Task Force on Human Trafficking, Hope and Homes for Children, the center received the blessing of the African Committee of Experts on the Rights and Welfare of the Child to undertake a continental study on orphanage trafficking in Africa, focusing on 5 countries. We contributed to high-level policy discussions and actively engaged in platforms such as the 9th annual convening on preventing violence against children in East Africa, in Nairobi, the Eastern and Southern African Regional Early Childhood Development Conference in Addis Ababa, Ethiopia, a training on strategic litigation before the African Committee of Experts on the Rights and Welfare of the Child in Nairobi, Kenya, the International Society for the Prevention of Child Abuse and Neglect Congress in Vilnius, Lithuania. We hosted the third child-focused research symposium, bringing together policymakers, researchers, and practitioners to share insights and emerging evidence, and highlighted our two flagship programs. Participants shared new approaches, regional data, and practical lessons that inform stronger programming and more effective policy development. Both programs show how research, policy, and practice work together to strengthen systems for children. A diverse cohort of interns supported our work as they contributed across programs, research, finance, and systems support, bringing skills and fresh perspectives. Our board of directors provided strategic leadership and governance oversight. This strengthened the center's institutional direction and reinforced accountability. And as part of the process, the board guided the review and approval of key policies to support effective operations and compliance. These are the approved policies in 2025. The board initiated and oversaw the process of developing the center's new strategic plan 2026-2031, which was grounded in a rigorous, participatory, and evidence-based process, ensuring that it reflects the center's achievements, addresses existing gaps, and aligns with emerging priorities in child well-being across Africa. We are excited and optimistic about the new direction for the next 5 years. As we reflect on 2025, AfriChild remains committed to evidence-driven action that improves child well-being. None of this would be possible without our dedicated staff, the unwavering support of our board members, funders, partners, and the communities we serve. We are deeply grateful to the children whose resilience continues to drive our mission. We acknowledge a greater force guiding our efforts and progress. From the entire team at the AfriChild Centre, we say thank you to you all for a successful 2025.